Hello, so today I'm going to be talking a little bit about our patient Jack. And in order to talk about Jack, we have to discuss his family history, which starts with his mother, Joy Newsome. His mother, Joy Newsome, was abducted at 17 years old and held captive for 7 years. Jack is the product of repeated rapes that Joy faced while in captivity by a man named Old Nick. They refer to him as Old Nick because they never uncovered his true identity. Jack and Joy lived in a small garden shed while in captivity, and the only sign of the outside world being provided through a skylight. Old Nick is Jack's biological father. However, Jack does not have any relationship with his father, as Joy would hide him when Old Nick would come for his visits. However, Old Nick was the sole provider for basic needs such as food, water, electricity, kitchen appliances, and heat while he was holding them captive. So while in captivity, Joy was Jack's only caregiver and attachment figure. However, post-captivity, Jack created strong bonds with his grandmother, who was Joy's mom, and his grandmother's partner, Leo. And Jack had met his mother's biological father. However, he remained estranged because he could not cope with the situation of how Jack came to be. So Jack is a 5-year-old boy who spent all of his life up until recently in captivity. He refers to the garden shed that he lived in as room, which he believed was the whole world, and outside of room, all that existed was TV world. Jack believed that the basic necessities that Old Nick provided were a product of magic. Before his escape, Jack had no exposure to nature, people, social environments, or anything a traditional child would experience at his age. Joy tried to provide Jack with a normal childhood by encouraging a detailed imagination and providing him with routine every day. However, Jack struggles to understand reality due to the imaginary world that he created while in room. In order to escape room, Joy had to pretend that Jack died due to an illness that he acquired while Old Nick cut the heat off in room. Joy rolled Jack into a carpet and told him to remain stiff while Old Nick loaded him into his truck to dispose of his body. After 3 stops, Jack unrolled himself from the carpet and jumped from the car and was able to alert individuals in his immediate surrounding of the dangerous situation, even though he was frozen in fear. Jack has significantly struggled with adjusting to the outside environment due to its constant stimuli, such as new people, places, and experiences. This sudden shift has caused intense emotional, cognitive, and behavioral challenges, including separation anxiety and selective mutism. So before Jack had escaped captivity, he had no treatment history at all regarding mental or physical health. Jack's mother had tried to keep him well nourished and provided comfort to him through breastfeeding and a multivitamin given daily. After escaping, both Jack and Joy have received comprehensive medical care. Jack was given a physical exam, all of his proper vaccinations up to date, sunglasses to help adjust to the brightness of the outside world, and a mask to help him stay safe from harmful germs in his new environment. In regard to mental health, Jack was evaluated by a psychologist after his escape, and Jack's mother, Joy, has had mental health treatment following escaping, which helps to indirectly support Jack's recovery. So Jack's presenting problem is that he's struggling with adjusting to the outside world after escaping captivity. Having not known anything other than the confines of the garden shed, Jack is suffering from severe sensory overload and emotional dysregulation. Jack faces selective mutism, choosing to rely on his mother for communication to others. On the rare occasion Jack addresses anyone else individually, He whispers and does not make direct eye contact with them. Jack is extremely attached to his mother, and when she's not next to him, he suffers from severe separation anxiety. Jack's mother, Joy, is also significantly emotionally unwell, which can impact his stability and symptom presentation. So all of Jack's psychological challenges stem from his early environmental conditions, such as prolonged environment deprivation, extreme isolation, and attachment circumstances. His identity, understanding of the world, and emotional development were all shaped by the traumatic conditions that he faced while in Rome. Despite the challenges that Jack is facing, he shows uttermost resilience and has a deeply strong bond with his mother. The difficulties that Jack is facing can be conceptualized to adjusting to a completely new environment and his developmental trauma that he is currently processing. With that being said, Jack has been given a DSM diagnosis of selective mutism.
Hi everybody. So based off of Jack's diagnosis of selective mutism, I did some research and was able to find some articles that could hopefully provide some insight into how we want to move forward with our treatment plan for Jack. So the first article that I found was kind of just a comprehensive overview of what selective mutism is and how it affects individuals. And then it really went into the differences between medication-based and non-medication-based interventions. And it also discussed a bit about comorbidities that commonly exist in individuals that experience selective mutism. So some of the comorbidities that were described were depression and developmental delays. The article also, as I said, went over medication versus non-medication-based interventions. In terms of medication-based interventions, the article stated that it is usually common practice to prescribe individuals experiencing selective mutism with antidepressants, as there are usually comorbidities that exist with those individuals. However, in terms of non-medication-based interventions, it is described that psychodynamic therapy, behavioral therapy, and family therapy are among the best in terms of progress for individuals that are experiencing selective mutism. However, the article in all stated that the best approach to treating individuals with selective mutism is to utilize an approach that implements psychodynamic therapy as well as pharmacotherapy. So a combination of both medication and non-medication based interventions. I think this article could be really insightful for us in planning a treatment plan because it provided options such as psychodynamic, behavioral, family therapy, as well as a medication-based option. I also think that the article is really helpful for us because it reminds us to keep in mind the existence of comorbidities and how common that is for individuals that experience selective mutism throughout our treatment of Jack. The second article that I found that applies to Jack's treatment was a follow-up study that was conducted on 36 children who received treatment for selective mutism. The treatment that they received was a version of CBT called MCBT, basically a modularized version of CBT. Now, the modules that were utilized throughout the treatment of these 36 children were psychoeducation for children and parents, physiological training, cognitive training, behavioral training, parental training, and educational/recreational staff training. The data used for this study was obtained approximately 1 year after the study was finished, and the data was taken from the parents of the children. And the tool that was used to measure changes in behavior was the Selective Mutism Questionnaire, which is otherwise referred to as the SMQ. The findings of this study concluded that 84% of the population that was studied no longer met the DSM diagnostic criteria for selective mutism just 1 year after treatment had concluded. So I think that this is really useful information for us in creating a treatment plan for Jack because it showed us how effective CBT, specifically MCBT, can be when treating children with selective mutism. As I stated before, the article and the study found that just 1 year later, 84% of the studied population no longer met the diagnostic criteria for selective mutism. So that's very positive to look at in terms of Jack, and there's a high likelihood that the treatment could really help Jack and work for him going forward. The third and final article I found described how psychodynamic play therapy can really help children experiencing selective mutism learn to communicate through symbolism. The article highlighted how children can revisit prior experiences and feelings through psychodynamic play because it allows children to use symbolism to revisit painful memories and feelings. The article focused on a 9-year-old girl and how she was able to use psychodynamic play to communicate feelings and experiences that she had within her family dynamic. Over time, the play was able to help her progress to a state where she was able to communicate non-directly with classmates outside of the home, which was very positive for this child. The data was obtained throughout the therapeutic process from an intake, updates from family members, and also notes that 2 therapists who had been working with the child were taking throughout the play sessions. I think that an article that describes how play therapy can be useful for treating individuals experiencing selective mutism is really beneficial for us in making a treatment plan, because it was shown multiple times that Jack really does enjoy different types of play. He loved to draw and color, and I think that this could be a really good way to help him process some of his feelings and hopefully reduce the symptoms of selective mutism while increasing socialization for him.
Hello, so next I'm going to be going over the treatment plan we designed for Jack from the movie Room. Sam kind of discussed how the presenting problem is selective mutism. Jack has spent most of his life living in a shed and room, so just since being released and like being exposed to new environments, people, sounds, and just a whole lot of different things. Jack is suffering from like sensory overload and having a difficult time processing his emotions. He seems to speak freely around his mother Joy, but especially when like around others or meeting new people, he struggles to engage in conversation and struggling with that. Jack has shown some improvement in his verbal communication with his grandmother and Leo after some time adjusting to his new home. And I think one of the things that helped Jack adjust was meeting Leo's dog Seamus. I think after meeting Seamus, Leo has grown to be more comfortable around Leo, and having that family support and having more people that he feels comfortable talking and conversing with is really important for him transitioning and adjusting to life post Room. Ryan discussed a couple of articles and journals and peer-reviewed sources. So Lang, Fernandez, and Sugay and Wong, they all demonstrated different interventions and techniques for selective mutism. But for Jack, I feel like using a cognitive behavioral therapy model can be the best fit for Jack. In Lang's article specifically, one quote that I have here, and I'm going to read, is there is significant improvement in selective mutism symptoms at follow-up after selective mutism-focused CBT, and that's on page 485. Given Jack's experience and trauma, I do feel that there really shouldn't be a timeline or an end date for his treatment. I think Jack will need continued assistance throughout his life and throughout his childhood and development, especially with his anxiety and everything else that he is having to adjust and learn and just process. So I think some of the goals and the techniques can be used to help open Jack up and help him express his feelings and process his trauma. But I don't think would be beneficial to have like an end date to his treatment plan. I think he should, continue to have help and use therapy and counseling and using his family as well as a support system to really help him adjust to living in the outside world after Room. So I'm going to go over some treatment goals and techniques. So one thing that was mentioned in class, and we've kind of talked about amongst me, Ryan, and Sam, is Feelings Candyland. And playing Feelings Candyland can help Jack label his emotions and also normalize talking about them. So using the different colors on the Candyland's map, whenever you land on a color, you would have to talk about an experience or talk about a time that Jack felt either angry, happy, embarrassed, or anything like that. So I think this game can be a great way for Jack to have fun and to practice taking turns, practice losing, but like really specifically getting used to and normalizing talking about his emotions. So for some of the colors on the map, red is I have here. It's going to be the color of anger, and it's going to be telling and talking about a time you felt angry. So if Jack lands on that, he would have to talk about when he feels a time he felt angry. Yellow would be a time that you felt happy. Orange would be a time you felt embarrassed about something. Green would be labeled and associated to being anxious or scared. Blue would be talking about a time you felt sad. Purple would be talking about a time you felt love. And pink would be talking about a special day or talk about a positive experience. So as I mentioned earlier, I think playing Feelings Candyland can help Jack learn how to take turns, learn how to handle losing, but specifically learning how to normalize talking about emotions and engaging in conversation with the game. The next goal and technique is processing trauma and developing a sense of control using clay. So I believe it was Fernandez and Suge who, in their article, they used clay to help with selective mutism. And Jack, I gotta sneeze. Okay, I think I'm good. Sorry about that. Okay, so back to it. Jack experienced a traumatic and uncontrollable environment most of his life. So I think I wish I could pause it. I'm using Photo Booth. So Jack experienced a traumatic and uncontrollable environment. Sorry about that. So Jack experienced a traumatic and uncontrollable environment for most of his. I really wish I could pause this, but I'm going to keep going because I have done this a couple times already. So back to using clay. So Jack experienced a traumatic and uncontrollable environment for most of his life. So I think playing with clay will help him regain a sense of control. Fernandez and I'm really sorry about that. So Fernandez and Suge found that there are different ways, like telling stories. I'm really sorry about that. What I'm trying to say is Fernandez and Suge found that there are different ways, like telling stories, sculpting emotions, and molding techniques using clay to help really feel like and have a sense of control. This would help encourage Jack to sculpt different emotions. You could ask Jack to create scenes from his life and use clay to either ask him to make the room or to make something else that he saw or something else that he likes. So using a story with clay, creating scenes from his life, and allowing Jack to reshape and change his creations. So if he's unhappy with something, use with clay, you can manipulate it and mold it into something different. So I think, Jack, that would give Jack a sense of autonomy and just having a little bit more control and experience, like help him feel like he's in a safe space, and in a controlled setting. Um, with so with clay, I think there is a lot of options and, um, for him to utilize it and to mold it in different ways. The next goal that I have and technique is building social and interpersonal skills using puppet play. So puppets are a really utilized play intervention in play therapy, and Jack lacks interpersonal skills to have conversations and communicate with others. Because Jack struggles with selective mutism, playing with puppets can help Jack communicate with others indirectly and develop conversational skills. I think this could also help Jack with, like, he tends to whisper a lot, but like having conversations or talking through either animals or people or different types of puppets, I think he can find his voice and practice conversations, and um, this can help with practicing taking turns, expressing his negative thoughts and feelings. I think using puppets can help you also better understand personal space and boundaries, and practicing different like conversations can increase Jack's comfort with social interactions. And I think puppets can also be used to tell stories. So Jack can use puppets to tell stories and really practice a lot of different conversations without feeling he's talking directly to someone, and being able to play and express different things through puppets. Um, so another thing I have here is Fernandez and Suge used puppets. However, they were used to express anger and fighting. But in the particular article, the client was a bit aggressive with puppets, but they can be useful to mold and practice like social situations and work on those interactions. So overall, with all these goals and techniques, with Feelings Candyland, using clay, and also using puppets, I feel like Jack would be very overwhelmed and pressured if a more directive approach was used. I think for Jack, because he does experience anxiety and other things that he's like with trauma. I think having a child-centered approach at the beginning would help to build rapport and trust. But I believe that Jack would enjoy playing these games and participating and can learn and benefit from all of these techniques. There might be pushback or hesitation to participate at the beginning, but hopefully, using a child-centered approach and using like CBT as a model, I think Jack can open a relationship and establish, a sense of like personal autonomy and boundaries, and just learn about his feelings and just allow him to have new experiences. And I hope that Jack would be open to sharing his experiences through puppets and clay and Feelings Candyland. So what supplies and materials or preparation would I need? So I would have, of course, Feelings. I would have the Candyland board game. I would have puppets. I think using animals and people would be beneficial because he might feel a certain way if he sees like people puppets or using animal or dinosaurs of some kind. So just having a variety of puppets, I think, would give him give him more options to feel comfortable and pick and choose what he wants to use and express and play with. And for clay, I think either using like a Play-Doh or like an air dry clay. Those are what I saw that are good clays to use to practice molding and to practice like different types of manipulation techniques with clay. Next thing I'm going to be going into is evaluation and effectiveness. So Jack is very nervous and hesitant when being around new people. I think Feelings Candyland, playing with clay, and puppet play are all play therapy techniques that could help Jack explore his feelings and emotions while developing interpersonal skills. Lang, 2015, measured the effectiveness of CBT intervention for selective mutism using the anxiety disorder intervention schedule for DSM-4 lifetime version, and then selective mutism questionnaire, and the child clinical global impression, the CGI, to measure and to evaluate the effectiveness. For Jack, I think it would be important to use the GAD-7 General Anxiety Disorder Questionnaire and the Selective Mutism Questionnaire, the SMQ. I feel like using the GAD-7 and the SMQ will help measure Jack's anxiety and selective mutism throughout his treatment. Like I mentioned previously, I don't know if it would be beneficial to have an end date. I think, continuing treatment and tracking his progress and experiences would definitely help him develop. I think it would be important to track Jack's behavioral progress in sessions and receive behavioral updates from Joy, Jack's grandmother, and Leo. Family support is another big component, and having with CBT, giving homework, and having his family also included in the process can be beneficial to Jack. So receiving behavioral updates from Jack's family can help identify unhealthy or negative behaviors that can be addressed in sessions. So really having that feedback from his family can give us things to work on or talk about, and having a better sense of like maybe a direction of how we use puppets or clay to his treatment. Okay, so where was I? Jack's family will play a critical role in his development and processing his trauma through his treatment plan. Receiving behavioral updates from Joy, Jack's grandmother, Leo can help determine if the treatment plan is effective or if it needs to be changed or adjusted. Children communicate through play and incorporate new things. Children communicate through play, and I think incorporating new things in Jack's treatment plan can also help him learn and further develop. So these are just 3 techniques, but there's other forms of play and other techniques that could be used and incorporated to have variety and to help Jack learn and try new things, because I think that would also be beneficial at a certain point in time. So ethical issues. For confidentiality, I think confidentiality is a major component in therapy. However, Jack's situation poses some ethical issues. There will likely be times where information must be shared with his family or other social workers, so maintaining Jack's trust and confidentiality could be extremely difficult. When working with Jack and working with someone within social work, we do want to be careful of what we share or what we talk about with others in regards to the client. But given Jack's circumstances, I think there needs to be some collaboration, and just it can be difficult deciding or managing that, because sharing information with family can damage or jeopardize your relationship with Jack, and can lose trust, and can make the relationship harder. So the next ethical issue is boundaries. So I think Jack might have a difficult time understanding boundaries due to lack of experience, but it can be something he can learn and practice in his treatment plan, like with puppets. Jack is very attached to his mother, so developing some healthy boundaries can be important and difficult as well. adjusting to a new home and being exposed to new environments can make boundaries confusing, which could lead to ethical issues. And learning how to interact and deal with people at the supermarket or at the park or at school. Different environments have different boundaries, and I think um, you know learning about those and working with Jack through things can be extremely difficult, especially when it comes to touch, which is going to be the next thing we talk about. Touch can be an ethical issue because Jack might not understand what touch is socially acceptable or appropriate. Jack will need to learn social norms using puppets. Uh, Jack needs to learn social norms, but using puppets can help Jack practice social situations and learn how to develop interpersonal skills. Due to Jack's trauma, he might be sensitive to touch, so educating Jack on body autonomy and boundaries can help. He can learn to feel comfortable with touch. Touch can be positive when you're comforting and consoling someone, but there are also negative forms of touch, like abuse or sexual. And I think having an educational component incorporated with the puppets or other, like with clay or other techniques, I think those would be things that Jack would need to learn and further develop. So that's what I have for the treatment plan and ethical issues. I think that Jack has a lot of trauma and can have a difficult time opening up in therapy, especially we saw in the movie with him talking to the doctor and really anyone else that wasn't Joy. But I hope that using Feelings Candyland, using clay, and using puppets, he can have a sense of autonomy and develop his communicational skills and processing his emotions and trauma in a more positive way. So that's what I have for the treatment plan. So thank you.